for 93, 94 years, like nearly 100 years,
Yeah.
we were actually even saying occupational therapy was seen as a form of psychotherapy. Somehow we need to, not just here in BC, not just here in Canada, but across globally, is
Hmm.
to really bring home this message that this is who we are. This is what we have to offer. And we are very effective. We are like a best kept secret. And we really need to let the world, this is what we have to offer. So this is the struggle, the current struggle that we have, because a lot of people do not know what an occupational therapist is, first off.
Yeah.
And then when you tell, this has been my experience, when you tell someone, oh, I'm an occupational therapist in mental health, oh, how does that work?
You're listening to the Brave OT podcast with me, Carlin Nink. This podcast is all about empowering occupational therapists to step up, level up, blaze some trails, and maybe engage in a little conscious rebellion in service of our profession, our clients, our work, our businesses, and living our mission wholeheartedly. We are all about keeping it real, doing hard things, unhustling, being curious, exploring, growing through our challenges, and finding joy, fulfillment, and vitality as we do. Really, we're OTing ourselves and each other. I hope you love this episode. Welcome, Michelle. I usually say I'm excited to have you here, but I feel the excitement is different. It's an impassioned call to support. And I'm more so honored to have the opportunity to highlight this really important plight. We will get into what that is, but can you introduce yourself first?
First of all, Carlin, thank you for having me. And this is an urgent issue. And I really appreciate having this opportunity to talk about this because this is a warning for all occupational therapists as to a potential road we're heading down that really we don't want to go down. Yes, my name is Michelle Ferguson. I am the chair of the Mental Health and Substance Use Practice Network for the Canadian Association of Occupational Therapists. That's just a brief intro. I've also worked for over 18 years in the public healthcare sector here in BC as well, and
Excellent.
private practice.
You do a few different things. You have a few hats.
I've had a few hats, yes.
Let's get right into the big issue at hand. I'm a mental health occupational therapist and in private practice here in Alberta to give other people context. So we have an international audience. We've got OTs listening around the world. And here in Canada, we're often seen as the place where OT really has a smoother pathway to being fully engaged as mental health clinicians. This is how we're seen often more internationally. And we're going to get into this issue that feels like it's threatening that. And we really want to really stimulate support from the OT community more broadly than just the province directly impacted more broadly than Canada. We can reach a lot of people. And if the more voices we have, the better we are able to hold some footing on our scope. So here in Canada, we are regulated provincially as occupational therapists, right? We there's a
Correct.
national exam, there's like a national entry point, but then we're regulated provincially. So we have colleges in each of the provinces, slight variations in terms, but you're in British Columbia, I'm in Alberta, and in British Columbia or BC and Alberta, there's the colleges, but the colleges need to support OTs in adhering to the regulations of healthcare professionals. And so there is that Health Professions Act
Mhm.
that the colleges, or you can get into that more specifically, but I just want to give that context. The colleges need to protect the public in making sure that OTs are adhering to the standards of the legislation under which we can function as regulated healthcare
Yes.
professionals, right?
Yes. The colleges hold our license to practice. So if we are not registered with the college, we cannot practice occupational therapy.
Right.
So basically, what has happened here in the last few years in BC, our government, our provincial government made a decision to amalgamate the various professional colleges. So for the last about 20 years, I don't know exactly when the College of Occupational Therapists of BC came into being. I believe it was around 1999. So approximately for the last 25 years, we've had our own professional college, the
Yeah.
College of Occupational Therapists. What happened is our government decided to amalgamate our college with several other colleges, including the psychologists, optometrists, physiotherapists, dietitians, traditional Chinese medicine, and acupuncturists. So we are going to be regulated by that new college. Doesn't have a name yet. That is a little bit of concern in and of itself. Is there going to be a different code of ethics for occupational therapists? How are complaints going to be handled if the college does not have an occupational therapist as well? So there's a lot of kind of this conundrum. But the most pressing thing is just last week, January 25th, we received a message from COTBC, College of Occupational Therapists of BC, saying how the Minister of Health, who is Adrian Dix, has this definition of what our profession is. And Carla, if it's okay, I will read out that definition
Please
of
do.
occupational therapy, their definition. Occupational therapy means a health profession in which a person provides the following services with respect to the performance by the individual of everyday activities of self care, productivity, and leisure. A. Assessing the extent to which the individual can perform these activities safely and effectively. B. For the purposes of maintaining, rehabilitating, or improving the safe and effective performance of those activities, such as treating the individual's disease, disorders, or condition using cognitive and physical methods, and modify the individual's personal and environmental conditions, providing information and counseling with respect to safe and effective performance of those activities.
And so I hear in there,
That's
we can use cognitive methods, we can use physical methods, we can assess their performance. And then it's really vague in that line about modifying personal and environmental conditions, right? Is that the wording? Condition?
yes, modifying the individual's personal and environmental conditions. So there's a few things missing there.
Yeah.
Individuals. No, we also see families, we see groups, we see the community. We're not just limited to individuals alone.
We
Okay.
consult in
Environmental
regulations,
health.
we consult in how things are organized, where
Absolutely.
there's broader sort of institutional consultation and advice. Yeah, it's not just individuals.
It's not just individuals, it's much more broader. I don't hear mental health.
No, unless it's hidden under modifying personal conditions. But that's not defensible. That's too vague to even
That is too big. And cognitive and physical methods,
very specific and narrow. Yeah.
that is. So the other issue, if that is not alarming enough,
Yeah.
I mean, the
Is
Minister
this
of
line.
Health is
All
basically
revisions and
overseeing
amendments
are determined by the Ministry of Health, our profession. And the concern I have is that we should be defining our profession. We know our scope of practice. Here we're having a person who's not even of a profession, but feels that he is qualified based upon
Mhm.
his position of authority to say what occupational therapy will be in British Columbia.
And it makes sense that consultation with the professions, we can't have a whole kind of government legislation written by a bunch of different, but there needs to be consultation with, do we know if there was any consultation with occupational therapists for this?
I don't even know how much. I can tell you with this amalgamation, it was
Yeah.
true. Bill 36. It was just pushed through. There was not much talk. In fact, opposition parties have been complaining about that because there's other parts of this bill with this amalgamation we're not happy with.
I can't imagine any occupational therapist would have supported that definition of our profession. No.
Actually, I can see in public health care,
Yeah.
this kind of is more fitting of what occupational therapists are doing. We're incredibly limited here in BC in public health care as to the service we can provide. And that's why there's actually been quite a mass exodus of OTs leaving public health care and going into private practice because they're able to exercise their own clinical judgment
Right.
as well as provide interventions that they see fit as well. So they
So
can
in
be more effective in private practice than here in public health care.
I can certainly relate as a person who left working for our public system to work in private practice, though I didn't ever feel that it was because of because my scope was restricted. Mind you, when I worked for the public health system, I worked in home care. And so it wasn't a specifically mental health role. But I know I went to the University of Alberta and we were required to do a mental health placement. So I did one in an inpatient psychiatric unit and didn't go on to work in that way. But I know here in Alberta, I was looking at the breakdown of occupational therapists, what they've declared as their area of practice. And 10% of OTs have specifically said they work in mental health. And then there was like 8% in neuro, like
Mhm.
5% or something in physical medicine specifically. Then there was a 20 some percent that was more broadly, like that was pretty general. But
Okay.
I feel like we're pretty nicely represented here in Alberta in mental health practice. I'm not working inside the public system though. I would expect I know there are OT positions in hospitals. I know there are OT positions in community mental health programs, but those programs tend to serve more severely impacted individuals. You're not going to be admitted to a psychiatric unit without a significant mental health condition or crisis. And a lot of these programs are more in that sort of crisis intervention area. So when we look at more preventative and mild to moderate conditions, we're relying on people's extended health benefits, and
Mhm.
that's a whole other issue.
I
Sting.
just want to say
Yeah.
there was a paper that came out, and I'm glad it came out. It's called Psychotherapy within Occupational Therapy Literature, a Scoping Review. And it mentioned your province, Alberta,
Okay.
and how psychotherapy has not been regulated, but actually that the Alberta College of Occupational Therapists have been encouraging occupational therapists to provide psychotherapy. So your college and your province has been very supportive of mental health.
And
Here,
interestingly, we don't call it psychotherapy here. So in
right.
Alberta, it's in our Health Professions Act. It's referred to as psychosocial interventions. And psychosocial interventions are listed as a restricted activity under the Health Professions Act, and specifically a restricted activity that occupational therapists can do. And yeah, it
Mhm.
is all over the Alberta College of Occupational Therapists website that psychosocial interventions, mental health practice, those are primary areas of involvement for OT. So there's certainly a lot of support for that here. But interesting, we don't use the term psychotherapy. We're already stated as providers of psychosocial interventions.
Here's the other issue. There's two things on the table right now is one to have occupational therapy, to have it recognized that we are mental health providers, as well as we do provide psychotherapy interventions.
Yeah.
And this is another issue is psychotherapy is looking at being regulated. It is in Ontario. They
Yeah.
have very strict standards. In fact, in order to provide psychotherapy interventions, and what I mean by that is dialectical behavioral therapy, cognitive behavioral therapy, anything along those streams,
Yeah.
you have to have a designation of a psychotherapist.
Yeah.
So, what we have been recently talking about too is that here across Canada, there was recently data collected that mental health occupational therapists are providing these psychotherapy interventions like DBT, CBT, everything that I just mentioned, prolonged therapy, we could go on and on.
Yep.
And yet we do not see ourselves as psychotherapists. We see ourselves as mental health occupational therapists who are
Right.
providing these interventions and that it is within our scope of practice. And that is one thing we really need to emphasize that psychotherapy and mental health overall is at the core of our profession. This is where our roots are for that paper I was just mentioning.
Yeah.
Psychotherapy and occupational therapy literature scoping review for 93, 94 years, like nearly 100 years.
Yeah.
We were actually even seeing occupational therapy was seen as a form of psychotherapy. Somehow we need to, not just here in BC, not just here in Canada, but across globally, is
Mhm.
to really bring home this message that this is who we are. This is what we have to offer. And we are very effective. We are like a best kept secret. And we really need to let the world, this is what we have to offer. So this is the struggle, the current struggle that we have, because a lot of people do not know what an occupational therapist is, first off.
Yeah.
And then when you tell, this has been my experience, When you tell someone, oh, I'm an occupational therapist in mental health, oh, how does that work?
That's the response.
That like,
Yeah.
how does that
Oh,
work?
I didn't know
So
OTs worked in mental health. Well, let me tell
yes,
you here at the hockey
yes,
rink.
exactly, exactly. And Carlin, you can share about everything you have to offer in your private practice. You have behavioral activation. You can speak to this better than I can. Maybe just relate. What are some things that you do as an OT in private practice?
So I think and I'm thinking about too, like how I operate differently from psychologists. Like I'm often working with clients who are
Yes,
also seeing a psychologist or not, and I can cover some of that too. But
I can.
I think about clients I've seen who have done years and years of CBT, for instance,
Right.
our public health system, paying privately, and they're going to a clinic or a hospital to receive these services. And I'm actually going out and meeting them in the community. So, for starters, there's context and location of function
Yeah.
and a functional focus. So, I'm meeting with these people and saying, "Hey, what do you want to and need to be doing that you're not doing or doing fully right now?" Oh, yeah, I'd really like to be grocery shopping. I'd really love to get back to work. I'd really love to not hesitate to go to my grandkids' school recital. And so what does it look like? I'm really isolated. I'm afraid to get out. I have these panic
Yes.
attacks. I've been off work. I'm on disability, not earning a full income, becoming disengaged with my family. Okay. So if these are our goals to be able to participate in these activities, and here's where you are now, the bridge between the two, what am I looking to address? So I'm looking to address anxiety, I'm looking to address phobia, I'm looking at activation, I'm looking at routine building, I'm looking at building tolerance to anxiety in the service of these occupational goals. I'm doing exposure therapy. I'm introducing
Yes.
new language. Often using ACT. Sometimes people
Yes.
have been doing a lot of CBT, and ACT brings a bit of just a fresh twist on a cognitive behavioral approach and a little bit of new language and a little bit of maybe let's not shame ourselves about the negative thoughts we're having. I go, yeah, of course I'm having negative thoughts. I'm scared to get out. I'm out in the community doing the exposure to the grocery store, the workplace, the volunteer, and actually actively doing these things with clients. And then also looking at what are you doing for fun? Oh, I love music. Hey,
Yes.
how are we engaging in music? I used to play in a band and I don't even go watch music anymore. Oh, okay. Can we set some goals around moving toward being more active in music and things like that? And so I love that as an OT, I'm able to bring in, certainly I'm bringing in aspects of more specific, like psychotherapeutic approaches like ACT and exposure therapy and motivational interviewing and all of these things. But it's in that occupational focus that I think that I have that we as OT
Exactly.
have. Like, because the people say, oh my gosh, I've done all this therapy, but now you got me back to my life. And you got me back to like really hands on out in the real world, not just talking about it. And through the experience, I proved to myself that I can do it. And that was what made me do it. I hear it over and over again.
So can you imagine if that definition of occupational therapy that we currently have here in BC that we're looking at was in Alberta and
Yeah.
how that could impact you, right?
Cognitive and physical interventions. Those were not. Those
Yes.
were not.
So consider this. If you are doing what you're doing and a complaint went to your professional college that has psychologists,
Yeah.
would they be seeing that you're operating outside of practice?
I would
So
hope. I
that's a
would
bit of the concern here is that
yeah,
we really need to overall define occupational therapy, make that clear. What is within our scope of practice? Because other professions are going to claim it. We really need to say this is what we do. There
yeah,
is that call to action, as well as yes, we offer a very unique lens
yeah,
unlike other professions, how we do look at the environmental factors, how they impact
yeah.
occupational participation. So this is a call for action. This is why I'm here is this is what's happening in BC. Please support this. We do not want this to have a ripple effect and affect other provinces. And yes, we really need as to act now and send a clear message.
And I think that OTs are really good at coming together and communicating with each other and supporting each other. So I hear a lot from our American colleagues that the scope of OT has really fallen out of mental health just due to the insurer making decisions about
Yes.
who gets what. I think that we really need to come together as OTs to continue to maintain this presence in mental health. It's the foundation of our profession. We started in
Yes.
mental health. And so in this call to action, we are inviting people who are not directly affected by the BC legislation. We're inviting our Canadian OTs, our international OTs to visit this form. I'm going to link it in the show notes and add their information to the form. So, by being able to have as many examples of OTs who are working in mental health, doing mental health interventions, being able to share that via the form, that will really help the BCOT to advocate in this need to not pass this amendment. And in doing so, this is good for our whole profession. So these voices
Exactly.
add, but it's part of, I think there's a bigger movement of OTs really standing up for mental health. And we want to. Like we're
Yes.
passionate about
And there's
it.
strength in numbers. And so that if we can rally together, support us, and we'll support you. If you are facing something like this, and hopefully you won't, because we'll get right to the root of this. We won't allow this to be. Let's support each other. We really do need to do that.
Yeah.
Come together. So thank you, Carlin. I really do appreciate that you saw what was going on. You saw the importance of this issue and how it would impact not just us, but like I was saying, the ripple effect that this could have.
Yeah.
Yeah.
Definitely see it. Have you read Kristen Neff's book, Fierce Self Compassion?
I can't, no, I haven't.
It's a good one. So she
Okay.
talks about the yin and yang of self compassion. And so when we think of self compassion, we often think of tender, kind, loving self-compassion. And she has a graphic where there's a mama bear on one side and a cuddly bear on the other side. And so your self-compassion is that version of self-compassion that stands up for our rights, that stands up for the people we love,
Mhm.
that stands up for
Mhm.
important things, that works at a societal level, at a familial level, that advocates, that is impassioned to protect, to advance, to support. And it also, in fierce self-compassion, there's a very strong and important feminist stance, but that we are most impactful when we're embracing a balance of both, where we can be tender and fierce. And I think it's a unique thing women have is that we have this beautiful, lots of men do too, but we're socialized more on the tender self-compassion side and bringing in our fierceness with a balance of humanity and kindness and gentleness and being heard is really powerful. And so I'm feeling that sense of that balance of both wanting to protect and advocate and also do it well, do it in a way where we're listening and we're conscious. And the mission of a lot of these changes tends to be, hey, let's be more efficient, let's be more effective, let's do all of those things. So none of this stuff is coming from a bad place. But here we need to advocate and say, oh, wait a minute,
Yeah.
there's risk of losing our professional scope. There's a risk of, and we need to stand up for that in support of the bigger mission. We want to protect the public. We want systems that
Exactly.
work. We want things to be run effectively. Like we don't want to stand in the way of change, but we want to be sure that where things could have really disastrous consequences for the public, for the profession, for the system, we need to speak up about that when we see those.
You hit a good point, and this is something I just want to emphasize. Here in BC, and this is all across the world, we have a mental health crisis.
We do.
We have a mental health and substance use crisis. And why restrict a profession whose scope is mental health from providing mental health services?
Yeah.
So this has a negative effect as well in that there's already a lack of access to mental health services. If this is our definition, it's going to limit that even more. And this sad thing is, as I've said, and is that mental health is at the core of our profession, right? This is what our heartbeat is. So don't take that away from us. This is what we have to offer, and we can help, we can benefit, and in fact, encourage mental health. It should be encouraged by the BC government. Yes. So that is what I'm really hoping is we can say this is not just for our benefit.
Mhm.
This is for the public's benefit, for them to have more options, more resources to access mental health, to get help. quality mental health.
Yeah. More access to mental health support is key. That is
Absolutely.
for the public. Yes.
Yes.
That is required. There isn't enough. And we could get into obstacles around occupational therapy not being covered by most health benefits plans in
Mhm,
Canada. There's
mhm.
a movement to advocate, ask for OT, and we're making important incremental gains. But
Yeah.
there's a long way to go still, and I think that, yeah, it's in moments like this where we need to speak up with that little bit of fierce compassion.
And look for opportunities. And myself and Anna Roneiser, we've been talking about social media and how we can utilize the power of social media to really advocate and support to promote occupational therapy overall as a profession, but also in mental health as well, be it TikTok, be it Facebook. And I'll just mention this. This is really sad. Island Health Authority, which has a population of 850,000 people, their mental health teams, they do not have an occupational therapist. They do not have a position for an occupational therapist.
Wow.
So I was advocating, or I posted on Island Health when they were promoting their mental health team. Mental health occupational therapists could play a key role in this. We can assess for what a patient's mental health symptoms, how they're impacting occupational participation. We can target this and help with the recovery process. So that's sad if we're not even going to be part of these mental health teams. And here's a population of 850,000 people.
Right. Yeah. So we want OTs to take action. We want OTs.
Yes.
The form is in the show notes, and reach out, right? And connect and talk about mental health and talk about, I even find how OTs dread the question at a social gathering. Oh, what do you do? I'm an occupational therapist. Oh, what's that?
Mhm.
And I've even met OTs who will sometimes just say they're a physical therapist because they don't want to get into that discussion. I always say I am a mental health occupational therapist, or I'm an occupational therapist and I have a mental health private practice. And then that's engages a curious conversation. Oh, what's that? How do you know? Or they don't ask, but it's those small ways we can increase public awareness by showing people what we do, by posting about cool things we're doing, by sharing about it. I know I'm very active on social media with my profile on a podcast. If we're going to use social media, there's more room to learn about how to get the most out of it.
I just want to add one thing too is please do help. The Minister of Health, he put this clear to us that comments on these proposed regulation amendments, he wants them to be submitted as soon as possible.
Okay.
We don't really have a deadline as to when they're going to finalize this decision. The notice we received is as soon as possible. And
Okay.
this was put out officially January 23rd, according to the Ministry of Health. I'm hoping within the next week or two that we bombard. We clearly send that message
Okay.
that we are mental health professionals, as well as we offer psychotherapy interventions for those two things to be on the table and accepted as part of occupational therapy.
Okay. Take action now. Don't put it on the to-do list.
Please, please.
Thank you very much, Michelle. This has been an important conversation, and I think it's just the beginning. I think there's a bigger conversation to have. First, let's get this one sorted, and then let's keep going.
Carla, thank you. Thank you so much for taking time to talk about this. Thank you.
My pleasure. So before you go anywhere, make sure you go to the show notes and fill out the form to help the British Columbia occupational therapists advocate for maintaining their scope of practice in the Health Professions Act, because supporting one group of occupational therapists supports the whole profession and they need our help. Second thing I'd like you to do is check out my Act for OTs course. I'm putting on a practical Act for OTs course. Acceptance and Commitment Therapy is what ACT stands for. And I found a lot of occupational therapists are taking ACT courses, reading about, hearing about ACT, and then not knowing how to implement it in a way that's really oriented to occupational therapy. How do they make that practical? How do they implement that? Especially OTs who are working in other areas of practice that aren't necessarily specifically mental health. we know that our thoughts and feelings, emotions, sensations can really get in the way of any type of behavior change. Perhaps it's behavior change that is in support of our physical health and well being. Perhaps it is around career development, around our learning needs. When these things get in the way of taking action and moving toward our goals, it's really helpful to augment our psychosocial toolkit with things like ACT. So sign up for my Practical ACT for OTs course. The link is in the show notes. It is at activatevitality.online/act-4-OTs. Again, it's in the show notes. Thanks for listening. And as always, be brave, OTs.